Welcome back, everybody. With World Oral Health Day coming up later this month, our next guest wants to make sure everyone knows the important role that oral health plays in our overall health.
Dr. Matthew Naraki is a prosthodontist at Jacksonville Dental Specialist. Welcome back to the show, Doc. And we're talking about World Oral Health Day. Didn't know there was one.
So that's actually later this month. So we wanted to, in light of that, kind of inform and educate our patients and the people of the area of the importance of oral health, your overall systemic health, your well-being, all those kind of things. And the numbers are staggering. With 300-something million people in the United States, over 180 million will not see a dentist. 1/4 of all those over the age of 65 are missing some or all their teeth, and that number is expected to climb to as much as 200 million in the next 20 years. Those individuals who are 30 or over, almost half of them suffer from gum disease or periodontal disease, and 1/3 of the whole population of the United States suffers from some form of tooth decay or cavity. So it's extremely prevalent, and the link between your overall health and your oral health are directly related. They're one and the same. They're hand in hand. So it's very important for people to understand this correlation and get on top of it.
Well, let's talk about, though, because you were saying it's systemic issues can lead, stemming from teeth issues.
Absolutely.
So let's talk about some of those things.
So the link between the health of your gums and your heart, cardiovascular disease, diabetes, certain types of oral and throat cancers, that's well established. And so that's something that we established. It's been well documented, and with those patients, you find that these untreated, unrelated, systemic diseases, they just tend to perpetuate. So many of our patients come to us and they think they have one problem, but there's over a host of problems. They have broken down teeth, they have cavities, they have gum disease, inflammation, but it ties in hand. They also suffer from some degree of diabetes, heart disease, high blood pressure, sleep apnea, which increases the incidence of stroke. Again, other types of cancers, heart disease. So it's all interrelated, and a lot of patients unfortunately don't know, or even if they did, they go undiagnosed because as you just learned, a significant portion of the population just simply doesn't go into the dentist.
Or they're possibly embarrassed.
Or they're embarrassed. And so, it's not just your systemic overall oral health, it's also your psychological health, your self-esteem, your social well-being. And when people get depressed and downtrodden, it also affects, they may not then take care of themselves. It affects their livelihood, their job performance. It's all interrelated. And so you're really able to help and change these people's lives, and that's something we've been able to do at Jacksonville Dental Specialists.
And these are all things that none of us want to have happen. So
No.
what are some ways to prevent these things from happening?
So, prevention is really key. One of the first things you can do is you start young, as early as sometimes 1 or 2. Even though your child may not have many or all their teeth in, it's really important to check their development, their dental development, their skeletal, their cranial, their head and neck development. So if problems are identified, they're identified early. You can plan properly, because some of these things can be very expensive and timely, but you have time on your side. Mrs. Jones, you're going to have this issue, but it's going to be in about 10 or 20 years, so you can plan or you can intercept so this child is not detrimented. For those older adults, it's important that those people who have minor or pretty minimal basic needs, minimum of every 6 months you should be coming in, at least once a year having an exam, once a year having throat and oral cancer screenings. Many of our patients who are diabetic, or many of the ones we happen to see at our Jacksonville Specialists who have had a lot of extensive work, we need to get them on a much more rigorous maintenance program. So those individuals are oftentimes seen as every 3 to 4 months, helping them manage, helping them keep more healthy so that you don't have all the work that was done good dental, but also it plays a big role in their overall oral health.
How can you decide, with all the dental specialists out there, though, how can you actually decide? What's
So
maybe
there's
some questions to ask yourself?
There's general dentists, there's specialists, where do I start, what do I do? One of the unique things that we've done is we've combined the specialties of prosthodontists and periodontists to create a comprehensive patient-centered approach. So patients can come in to see us, and we can, from the minor needs to the most complex needs, we're able to handle that. As a prosthodontist, we're the only specialist in dentistry that is trained in comprehensive care for adults. For some of our younger patients who end up needing much more extensive work, particularly children, sometimes a pediatric dentist, a pedodontist we work a lot with, and the other specialists. And certainly those people with routine or minor needs oftentimes are perfectly fulfilled by seeing their general dentist. So if you don't know where to start, give us a ring. We'll help point you in the right direction. But our philosophy is we try to have a comprehensive patient-centered approach, albeit though at a much higher specialist level of care.
And so many different things to consider and concerns. Best way for people to come see you guys, either the consultation or you have the seminars coming up, right?
It really comes down to education. And so one of the things for people who are suffering from tooth loss or extensive needs and they want to know what some of their replacement options might be, our seminars are a great start. Our next one is Wednesday, March 22nd at 6:30. For those individuals who might have other questions, give us a ring. We'll take you into a consultation. We'll discuss everything, do an exam. But that's the two places to start. Education is key. Once you're informed and you know your problems and you know where you want to go, we can help you get there.
Appreciate it. Stay on top of it.
Yeah.
Appreciate it, Doc. We want to thank Jacksonville Dental Specialists for making this segment possible. And you can call 904-460-4201 today to schedule a consultation, or you can visit their website to learn more. It's jacksonvilledentalspecialists.com.